Estás en sintonía con WCEA TV, tu canal hispano.
Bienvenidos a un especial de El Planeta hoy desde el Harvard Street Neighborhood Health Center. Este centro de salud comunitario atiende a miles de pacientes y es una parte vital de los centros de salud que existen aquí para nuestra comunidad. Hoy celebramos la Semana Nacional de los Centros Comunitarios de Salud y entraremos a las instalaciones del Harvard Street Neighborhood Health Center para celebrar no solo la salud, sino también el arte y presenciar la entrega de firmas que se va a hacer aquí en el Centro de Salud para apoyar en los presupuestos, que no hayan recortes de presupuestos para los centros de salud a nivel nacional. Pues la labor que ellos desempeñan es una labor importante que debe seguir adelante y que todos debemos apoyar. Acompáñenme a este especial de El Planeta hoy.
National Association of Health Centers asked health centers like us to do something just to recognize this week, to get the word out. We've invited El Planeta is with us and some other folks to just get the word out to the neighborhood that we're here, what we do, the service that we provide is a critical one, not just here in Boston, but nationally. I want to say there are about 1,300 health centers nationally. We've got 23 here in Boston. We've got 50 in Massachusetts. And this is just an opportunity for people to kind of sit back and kind of take stock in what we do. And that's simply why we're here. We've got my good friend, State Senator Sonia Chang Diaz is with us. I'm going to have her up in a moment. She represents this neighborhood in the State House and does a fabulous job. So we thank her for taking the time to come out and be with us just so we could share our story with her in terms of getting the outreach and the word out what we do. One thing we do as a health center is we have outreach workers. And their job is to literally go out, grab people by the ear, bring them in, sign them up, and make them healthy. That's what we do. And we've got a couple of folks who aren't with us today. They're actually moving on, but Fresnel and Nadej, as well as Teresa Randinelli. I want to make sure I get that right. Teresa, come here for a second if you would. A couple of months ago, just to recognize their effort, 2014 Community Service Award presented to Teresa Randinelli for your remarkable outreach and enrollment efforts, everyday commitment to patient advocacy, and continued presence in the community have made a positive and substantial impact on healthcare reform and support the mission of Massachusetts Community Health Centers. With respect and gratitude, signed by Jim Hunt, who runs the Mass League, and Antonia McGuire, who's the board chair and runs the Edward M. Kennedy Health Center out in Worcester. So Terry, thanks so much. Several months ago, we were asked as a health center to collect signatures from patients, from colleagues, to send them to Congress. Every health center in the country was asked to do it, and the goal was to get 500 to send down to D.C. with the message, don't cut health centers, because we're very important. Now, Natalie Jean, who's Natalie, right here, our very own Natalie Jean had just started. I said, Natalie, welcome aboard. I need 500 signatures, and she got right on it, and we got about 550, 600. I think 61 submitted 500 or more signatures. So as a result, they sent out a nice little plaque saying thanks for your effort. So Natalie, I want to say thank you to you. And I think the folks who do this for a living, it sends a message that we're involved. and we're working it, and we take this stuff seriously. So it is kind of a small thing, but again, I think it resonates to the people who pay attention. Again, State Senator Sonia Chang Diaz represents, what's your district?
Second Suffolk.
Second Suffolk District, which is right here at 632 Brazil Ave. I wanted to present Sonia with the actual signatures so that she knows, and I know she knows this, I'm preaching converted here, but just as a visual representation of the effort of our patients and of our colleagues here, just to let you know that these are the people who signed it, who realize what we do here is critical. And it's a service that we provide to folks who perhaps otherwise would not have an opportunity to stay healthy and be healthy. And I'll tell you, we've got a bunch of providers who are world class. We've got just great staff, great support staff who take this stuff seriously. And again, this is a recognition of that. So I just wanted you to have that, and I want to welcome you to say
Good afternoon, everybody. It really is a pleasure for me to be here, and to hear the work you can hear the cleaning going on over here. It just keeps going, and because there's so much need in the community, and there's so much good work to be done here. And I really want to salute all of the staff here at the Community Health Center who make it happen every day. I'm just curious, how many people are on staff here at the Community Health Center? And can we just give some love to the people here? We've got WIC back in the corner here, dental over here, and you've got, what are the other functions?
We've got laboratory, we've got OB right behind you, we've got PD below, family medicine down below, behavioral health down the street.
Fantastic.
Food bank downstairs.
Food bank, behavioral health, family practice, it's incredible. And I gladly receive these signatures. Charlie assured me that they have already been given to the members of Congress for whom they were originally intended, so that we can send a strong message to Congress to not cut funding for community health centers. But please know that at the state level, I'm 100% with you on the team, and actually I'm glad to report that this year in the state budget, which Charlie knows something about, that we got a small piece of dedicated money in the budget for the Mass League of Community Health Centers to be able to do technical assistance for all of their member community health centers to make sure that the service that we're delivering is and it's an easy thing for me to say yes to and feel enthusiastic about, because as we are going through this process of making sure that we can deliver universal health care in Massachusetts and do it at a cost that is sustainable for the state, and sustainable so that we can keep delivering on that promise of 100%, we know that community health centers are our most important asset. I don't think I exaggerate when I say that. Our most important asset and our frontline workers in being able to keep that bargain with the people of Massachusetts, that we're going to deliver quality care to everybody at a cost that we can all afford. And community health centers are making that possible in a way that really would not be the case if you weren't here doing it every day. So I say a very heartfelt thank you to you and to all of the consumers here at the center. I'm just curious if anyone is who do we have here that's a consumer in the room? Maybe everyone's in the rooms in appointments right now, which is as it should be. But for anyone here who can spread the word about the great service that's happening at Harvard Street and our other community health centers, we want to get more people in the door. And then lastly, I just want to say about the outreach work on signatures. Is it Claudia D? Natalie. As a political operative, I will say I know how hard it is to get 500, not just 500, 550 signatures. And that's a huge testament to your work, that of all of the community health centers in the country, that there were only 61 who did it. And it's so important that, here at the health center, you're not only educating...
One in Massachusetts.
One in Massachusetts. That you're not only educating... No, you should brag on that. You should brag on that. That you're building the habits of good health for the community, but also the habits and the knowledge and the empowerment about how people in this community can be self-advocates, not just for the healthcare, but for the policies that are going to make our communities healthy. And that's, right up there with good habits of maintaining health, and also habits of being engaged and authors of the own solutions that we need in our community. So thank you for that work that you do, and keep it up.
Another reason for this little get-together today is some of you may notice some of the beautiful artwork that we have up on the walls, and there's more up top and downstairs in pediatrics and a couple others, I think, downstairs in family medicine. That is from a nice collaboration that we have with the Art Connection. which is it's a small but powerful nonprofit here in Boston and up and down the East Coast. And what they do is they partner with nonprofits to place original works of art in facilities like this, for no other reason than to brighten the joint up. I think it adds a lot to any type of facility. We were talking earlier when I first got here 7 months ago at Harvard Street, the first thing that dawned on me when I walked in is that we need to brighten it up a little bit. So we found out about the Art Connection. We reached out to them, and you know, Sarah came in, and we had a nice meeting, and it worked out great. So we have, I think, 22 pieces? And ultimately, we don't have 22 on the walls yet, but we've been given 22 pieces that we have to get framed up, and we're going to get it around. So again, we want to publicly thank the Art Connection for your work, and we're here to support you.
And I should mention that Sonia is a champion of the arts in Massachusetts as well, so we're grateful to her for her support. Every time we get asked to advocate for the arts and write or call our state senator, she's already got our name there publicly signed, so instead of asking her to do something, I'm thanking her for what she's already done.
Y vemos a este hermoso grupo de gente, el staff e invitados especiales a este evento del Harvard Street Neighborhood Health Center. En esta ocasión no solamente celebramos el arte y la salud con hermosas obras de arte conseguidas a través del programa de Art Connection, sino que también hemos presenciado la entrega de 550 firmas que apoyan más presupuesto para los centros de salud. Este evento en el Harvard Street Neighborhood Health Center pues nos recuerda la importancia de los centros de salud para nuestra comunidad. En esta, la semana en que se celebra justamente la labor que hacen estos centros por todos nosotros, centros que ayudan a nuestra comunidad, que sirven, que nos recuerdan que la salud es lo más importante. Vamos a seguir en este evento presenciando más de lo que tienen programado para el día de hoy aquí en el Harvard Street Neighborhood Health Center. Y esto es El Planeta Hoy.